All right, so I'm going to be reviewing Chapter 7, which kind of focuses on confidentiality and privacy, and then the associated case study focuses on a patient refusing care, and it kind of ties in the privacy and confidentiality issues. So, for many rural providers, the line between personal and professional relationships can easily become blurred. Rural areas have a strong sense of community, and many patients are friends with or family members with other patients or even the provider themselves. So, confidentiality and privacy are essential to establishing trusting relationships with patients, and respecting confidentiality and privacy is actually a legal mandate for providers, and it's written in the Code of Ethics. So, maintaining confidentiality in rural communities can be difficult simply because residents are often part of each other's lives and activities. Some communities actually inform the residents about others' hospitalizations or deaths through local radio stations or newspapers. This then poses a challenge for providers as it puts their ethics and moral values to the test. So, in this case, Dr. Sampson is a rural health care provider who has a patient named Bob Jones. The patient is presenting, complaining of weight gain and shortness of breath. The patient was found to have proteinuria, and it was determined that the patient was suffering from nephrotic syndrome. There's also a concern about a possible malignancy. So, Dr. Sampson knows that Mr. Jones from the gas station where he works, and he delivered Mr. Jones's son, as well as he knows Mr. Jones's wife on a personal and professional basis. So the patient was informed that a kidney biopsy needed to be done to confirm this diagnosis. The patient is refusing care because he does not want to place a financial burden on his family since he doesn't have insurance. The patient is refusing to let Dr. Sampson talk to his wife and states that he's just going to tell her that the doctor said to lose weight and exercise. This then places Dr. Sampson in a very difficult situation because he wants to maintain patient confidentiality and respect his autonomy, but he also doesn't want to lie to Mrs. Jones if he sees her or if she asks about her husband. So, Dr. Sampson believes that discussing the treatment for this condition, as well as how implementing treatment will prevent long term consequences, will help Mr. Jones see why this is so important. So, Mr. Jones is a family man, he's a good husband, hardworking. And Dr. Sampson feels that his current choice to refuse treatment doesn't exactly reflect his character, and that his reasoning is not reflecting his value of family. So, for this case, I would review confidentiality with the patient, but also conduct an informative discussion with him regarding medical management. Another thing that I would want to mention is that the patient could apply for Medicaid or other programs that would possibly provide him with insurance so that he can get that kidney biopsy and afford any necessary treatment. This case provides a great opportunity to utilize motivational and interviewing skills, so asking the patient how he thinks his family would feel or react about his diagnosis, mention that his child and his wife would want him to be around and to be healthy in the future. So if I were Dr. Sampson, I would also mention that I don't feel comfortable lying or keeping information from the patient's wife. I would also explain to Mr. Jones that sharing this diagnosis with his family may be helpful because he'll then have a support system. If Mr. Jones's if he changes his mind about sharing the information with his wife, I would maybe see if you'd like to set up an appointment with both of them so the three of us could talk and discuss his condition about how best to manage it, what to kind of expect, how his wife can help. It's naive to think that confidentiality breaches do not occur in rural areas, but as providers, it's our job to do our best to prevent that from happening. There are a handful of times where exemptions to maintaining confidentiality are acceptable. These include testifying in court, reporting communicable diseases, reporting wounds that bring criminality into question, reporting impaired drivers, identifying those at risk, reporting workers' compensation, cases, and reporting abuse. These limited exceptions are intended to protect the public and, in some cases, the patients themselves. So, unless there's a clear and unambiguous legal exception, healthcare providers should dedicate themselves to maintaining patient confidentiality and privacy. So, this case would not be one of the listed exceptions, and therefore, pushing the situation through Mr. Jones and providing proper education is the best choice. I do think that including his wife, kind of in the decision making, may help Mr. Jones come to terms with a more realistic approach to his disease. It's definitely something that can be manageable, and I don't think it said his age in the case study, but I'm assuming if he has like a younger child, he's really not that old. So yeah, like I said, I think it'd be a great opportunity to utilize motivational interviewing skills to kind of assess why he's so adamant in refusing care or telling his wife. But yeah, it can definitely be difficult in rural areas to maintain that confidentiality because everybody's friends with everybody and everybody kind of knows everyone's business. I know one of my friends, she's from Richardson, and she said that they post like even things that you're doing in their local paper. Like she went to visit her grandma one day, and the next day it was in the paper that she came to town to visit. So I can only imagine how difficult that is for rural providers, and makes me have a better appreciation for how they're able to manage personal and professional relationships. But yeah,